I got my conventional medical degree in Hungary actually a while ago. And it's people say, oh, in Europe, when they hear that I studied medicine in Europe, they're like, oh, I'm sure it's more conventional. I mean, more holistic. You guys study about it, but it's not. It's not at all. It's the same system as in the US, and it's really good for certain things. But over the past 10 years, I've learned a lot about functional medicine, herbal medicine. I'm actually working on getting my conventional medical degree over to the US so I can practice here as an MD, probably as a family medicine doctor, but like in a holistic fashion. But in my current function, I have a herbalist, a clinical herbalist license in the US. And my website is called Frontier Advanced Health Coaching. And basically, the main areas that I like to focus on are autoimmune issues, cancer related, so cancer treatment related things where people are going through cancer treatment, support the body the best we can. And you'd be amazed how, just incredible results people have when you combine when you bring in the integrative, the natural, the holistic treatments. Do you guys hear me okay back there? Okay. I wonder if you can get more chairs when Catherine's available. Would you mind?
I apologize in advance. I had an appointment and I might need to leave, so maybe
Okay.
I should sit further back and I'll ask
Whatever suits you. Absolutely. Thank you. Oh, that's absolutely no problem. Thank you. And then metabolic issues, things like blood sugar problems, because that is really an epidemic in the United States. So are the other two, and they're all interconnected. And the topic of today, if I want to go back, how not to lose it, stress's role in these chronic diseases, especially in cancer. That's what our talk is going to focus on. And feel free to interrupt. Like if you have a question, you can raise your hand. It's kind of a smaller group, so we can kind of keep it more interactive. And I want to keep it interactive. Okay, so this is for education purposes only because neither of you are my client. So especially if you have a medical condition, before implementing these, make sure that you work with your naturopath or whoever is your specialist to do that. So we all know that stress exists, right? And how many of you had stress this past week? And I want to say that not all stress is bad. So this is the main thing, is that we live in a world. I mean, we can't avoid going through challenges, right? Whether it's relationships, whether it's financial things, we all go through seasons. We all go through things that challenge us, and that is very healthy. If you didn't have that, you would just stay the same, and you wouldn't actually, develop as a person. You would not grow in love. You would not grow in your spirituality. You would not grow in your skill set. But when there is something or some things that are chronically present in our lives, and we just can't get away from that, and our bodies have a hard time adapting and figuring out ways to deal with it in a healthy way, that's when health issues will ensue. I'm going to get into some physiology and all that. So again, I'm trying to keep it in a way where it makes sense for everyone. If you have any questions, again, just feel free to ask. So the two ways your body responds to stress, the two main systems, are the hypothalamus, pituitary, adrenal, and a lot of people put in the thyroid gland, that axis, which is basically a hormonal or an endocrine response to stress. How many of you have heard of the HPA axis? If you read, natural literature, or if you read health literature, nowadays there's a lot of talk about the HPA axis. Basically, your brain tells your adrenal glands, those small little glands that sit on top of your kidneys, which are very tiny, but they're without them, basically you would be dead in just a few hours. So they're very, very important. The adrenal glands are in charge of you being able to respond to external stimuli. So what your brain will tell your adrenals in response to stress is to make more cortisol. That's going to be your main currency for stress response on the hormonal side. On the other side, you have the sympathetic nervous system that also is going to talk to your adrenals. So that's the nervous system. Instead of a hormone going down, a nervous system going down. I mean, a nerve going down and telling your adrenals, put out more adrenaline. So that's the other currency, is you're going to release more adrenaline. That's adrenaline is basically when you have an acute stress. Yes, sir. Oh, sorry. Can you guys? I feel like I'm already shouting. If we can maybe huddle a little bit more, but I'll try and speak a little bit louder. Am I talking loud?
You're fine.
Okay. So here are some of the effects of chronic stress. Number one, immune dysregulation. If you know someone who has an autoimmune condition, or you have an autoimmune condition, have you experienced that when you're under stress, you have more symptoms? Right? People with Crohn's disease, people with rheumatoid arthritis, people with lupus, they all would tell you if you ask them, or if you have that yourself, that when you're under, especially when you're under heavy stress or chronic stress, you have more symptoms. Part of that is because the immune system gets into this imbalance, right? The other thing is high blood sugar levels. So cortisol actually and adrenaline will tell your body, we need to mobilize energy. Because there's a stressful situation, we need to just mobilize energy to be able to deal with that. If that stressor lasts you a long time, then your body will be constantly in this state of I have to be ready for this, I have to be ready for this, and your glucose levels stay higher. So your hemoglobin A1C, for example, which is a measure of the past 100 days, glucose, is going to stay high. So people with diabetes, pre-diabetes, stress is a big thing. Oxidative stress that will lead to DNA disruption, DNA damage, right? And a state of hypercoagulability, which means that your blood is thicker, so that you actually are more prone to developing blood clots. And in cancer, we have this, already this state where you have more of a tendency to develop blood clots anyway. And part of that can be stress, and part of that is that cancer likes that stickiness, that stagnation. Actually, in Chinese medicine, which is, I trained in that when I was doing my herbalist training, in Chinese medicine, they consider cancer a state of stagnation, a state of blood and qi stagnation that needs to be moved. So they use a lot of moving herbs that move blood and move qi in cancer protocols. So can we name a few stressors just off the cuff? What can be stressful?
Illness in the close family member, seriousness.
Yes. Work, yeah, sure.
It's
Kids. Yeah, I have to, I understand. Traffic, yeah, exactly. Acute stress, traffic, or chronic if you sit in traffic all the time. Anything else?
housework.
Not sleeping, housework, yeah.
Cooking.
Look at that. So being overworked and underslept, or more than half of the Western world, right? Like we live in such a productionistic kind of society, performance-oriented society. We need to, whether it's perceived or reality, we have to work more, make more money, etc. Dietary habits, relationships can be a tremendous blessing. How many of you know that? Or a tremendous trouble, right?
Yeah.
And maybe all on the same day with the same person, right?
Right.
So finances, can't avoid that. Substances, it can be a cause and an effect when you're trying to deal with something and you just can't, and you default to substance abuse. That's going to put you in that vicious circle. Spiritual depravity. So unfortunately, in conventional Western medicine, we have stripped medicine from spirituality so much. Where it's like everything is molecules, everything is just, molecular junctions and anatomy and all that. That's great. But, historically, for thousands of years, we've been, wedding spirituality with medicine. That's how it's supposed to be, right? So that's a big thing. Various stages of life carry various forms of stress. Of course, what I want to highlight here is that there's quite a bit of studies in the literature where they were studying caregivers, people who maybe they were caring for their loved ones, their parents who were ill, or their spouse who was ill for a longer time, and that took a toll on the person. I'm not saying that that's a bad thing. I mean, we obviously want to take care of those people. I'm just saying that like when you study the person who is in that caregiving relationship day in and day out, they're in their home, they can't get away from it. Their immune system looked like somebody who is 10 to 20 years older. So they looked at that person, and so it really aged their immune system. But there's just different things in various stages. So do you guys remember when maybe in biology or anatomy, we were learning about the parasympathetic and the sympathetic nervous system? So in a very simple way, the sympathetic nervous system is basically your fight or flight. So when you are under stress, your sympathetic nervous system gets more activated. The parasympathetic nervous system is basically your rest and digest. So that's, like when I push this button and I'm like, I just want to, I just sip my water or whatever and just have a nice meal and just like close my eyes. That's when the parasympathetic nervous system gets activated. So, and neither of them is better than the other. We need both, because if you didn't have your sympathetic nervous system, you couldn't deal with your daily things. So it's a concept of balance, but in our Western kind of lifestyle, generally we shift over to that sympathetic overload, where the parasympathetic nervous system kind of gets outweighed by the sympathetic one. We are always in this like go go go, stress. Those nerves are going to be firing a lot more. Interestingly, studies show that when animals are under chronic social stress, if we can translate that to humans as well, those sympathetic nerves responsible for the stress response, they will grow like muscles. It's like your body remembers, oh, I'm using this pathway all the time. So that's what your body is going to grow, because you need more of that tissue, more of the nerve tissue, to be able to carry out the sympathetic firing all the time. Does it make sense? It's kind of like, you do biceps curls all the time, then your biceps is going to get big. If you're in this constant stress, then the sympathetic nervous system is going to grow. And even in the tissues, you will see more nerve fibers. So then the next time you will get stressed even more easily. So this is actually interesting. Like when kids are exposed to social stress in their homes growing up, then as adults, they are much more prone to having anxiety, and they feel it in all their tissues, because those nerves, they basically have been established there in a profound way.
That's interesting that you say that.
Yes.
I think I like the first time actually being to slow down the muscle.
Right.
So if you muscle, then it's harder for to actually.
You're so used to the other pathway. Yeah. Yeah. It takes some work for sure to get the balance back, and we'll look at that. So the vagal nerve is the main nerve. It's the 10th cranial nerve that basically is responsible for a lot of the parasympathetic, that rest and digest kind of response. So the vagal nerve will counterbalance the sympathetic nervous system, cooling down inflammation, calming oxidative stress, and basically putting us up like, hey, sympathetic nervous system, yeah, you need to chill out. And that's very interesting. Your vagal nerve, the two vagal nerves, they run through your diaphragm. So, basically, and when you breathe, when you take a deep breath, your diaphragm flattens. So when you do breathing exercises, you actually activate the vagus nerve. And it's going to tell your brain everything is okay. We need the rest and digest. That is why breathing exercises, we'll look at them in a moment. We'll mention that some more, but that's why they are effective in activating the parasympathetic, like rest and digest phase. Immune system wise, basically, when you constantly run your sympathetic nervous system, you're going to be in a state of more inflammation, and you will have less of an ability to fight viruses and cancer cells. So that part of the immune system, the cellular response is what we call it, that is responsible to kill off, cells infected by viruses, and also, again, cancer cells that are supposed to be picked out by your immune system. Like, hey, that's not right. You need to be destroyed, basically. So that part of the immune system gets lessened with that chronic stress response. I know it's it's pretty fast paced, but I just want to give you guys an idea on all this. And there's a lot of research behind these. So cancer cells, so you on the right, you see when you see that little cell as it grows. So cancer cells can actually feed off of both adrenaline that is released from your adrenals and noradrenaline, which is released from direct innervations. So there are sympathetic nerves directly going to the tumor's tissue. And then guess what? So it hijacks that nervous system, the sympathetic nervous system. It actually tells those nerves, grow more, grow more, grow more, because we want more of the noradrenaline. And that's what, so it releases these substances called BDNF and nerve growth factor as like a fertilizer, telling the nerves to go more deeper into the tumor tissue and put out more noradrenaline. So it's very, very interesting how, the cancer cells can actually hijack the nervous system in that way, the sympathetic nervous system. How many of you have heard of beta blockers for, heart? Yeah. So some of you may already take it for mostly heart conditions. Interestingly, one of the biggest, breakthroughs in cancer research was that they realized how much beta blockers hinder cancer development. Because what they do is they tone down the sympathetic nervous system, that fight or flight response. They don't just do it on your heart, but they do it in other tissues too, especially the non-selective ones. So basically what they're noticing is that people who are taking beta blockers, they're less prone to developing progressing prostate, breast, lung, ovarian, and cancers and malignant melanoma. And they actually found that it's most effective on triple negative breast cancers. They also have found that surgery-related spreading of the cancer, which we do see when there's a surgery, because it's a stress on the body, it does shock the nervous system. So if people take beta blockers, that actually is less of a factor, less of a problem. Oh, just a couple other ones. So these are some specific numbers in breast cancer mortality with people taking, women taking beta blockers, ovarian cancer. But again, non-selective ones were more profound in their effect than the selective beta blockers. So the other thing that cancer cells can hijack is not just your nervous system, but your immune system. So here's a macrophage, which is one of your kind of more primitive immune cells. This is part of the innate immune system. What they do is they gobble up basically bacteria. They gobble up tissues that are breaking down. When you have a wound, macrophages come in and they're kind of like the cleanup guys. So when you are under stress and that, fight or flight response is on, it actually hijacks those macrophages for cancer development. It will cause more inflammation, more new vessel growth. That's what that little VEGF, which is called VEGF, causing more, vessel growth. And then the MMPs, the fourth thing is basically it's an enzyme that breaks down tissue so that the cancer can spread. So all of these can be accelerated if the sympathetic nervous system, the stress the stress response is on. And the problem with this is that when you think about this, when someone gets a diagnosis of, having cancer, like what are they going to feel? They're going to be very stressed, right? I mean, that can be very scary. And that's just, that's something really that needs to be addressed during that treatment. It's not just about like targeting, cutting out the cancer or just targeting it with chemo, but it actually has to be addressed in a more holistic fashion. So we need to strengthen the body. We need to strengthen the nervous system. We need to calm down that sympathetic nervous system as much as we can so that the body has that robustness to actually go through the treatment and be successful. And this is like a counter slide, like I'll show you one after the other. Basically, the vagus nerve, again, that shuts down everything that the sympathetic nervous system would cause. So again, there's that counterbalance. I think it's the last thing here is that when you're under stress, you may have heard that if you're under chronic stress, you are in a pro-inflammatory state. And part of that is that your bone marrow, imagine this, your bone marrow actually will produce cells that will shift you more into a pro-inflammatory state. Like your nervous system tells your bone marrow, where your immune cells, your red blood cells, your platelets are being created. Make cells that are more, that basically are more inflammatory. It's a shift that way. So just imagine, like just to think about how many different layers, that plays a role in, it's very incredible, right? Cancer can hijack other immune cells other than macrophages too, like lymphocytes and dendritic cells. So, and here are some of the, this is, I just put this, 2 herbs, there's a lot more actually that interfere with the COX-2 route. But turmeric and boswellia are, for example, 2 herbs that can intercept that the stress response through the COX-2, which is basically it's an enzyme that makes inflammatory hormones. Let's see. So the overall kind of the summary of stress and the immune system, the consequence will be chronic inflammation, more susceptibility to getting viruses. I mean, how many of you have experienced that when you're under chronic stress, you're more prone to develop just a viral infection, right? It's part of that is because your natural killer cells are not as functional and your T lymphocytes are not as functional. You shift over into a different kind of immune state that's more susceptible to catching a virus. Diminished vaccine response, it has been noted. Diminished T cell maturing, slower wound healing, and just overall, we talked about this, the natural killer cells and those specific T lymphocytes, they are part of the cellular immunity. So we talked about surgery a little bit, but that's basically just a summary slide on that. So our role, it's not that we are against surgery when it comes to cancer, but it is, we do need to be kind of mindful of those things, of the negative effects, and kind of support the body, promote an anabolic response. The upbuilding, instead of letting the body break down, we have to support it with herbs and with nutrients so that, the person doesn't lose muscle mass, doesn't lose, nerve power and all those things. How many of you have heard of heart rate variability, or HRV? You have? Okay. So it's actually kind of a novel, not so novel, but it's more popular these days in the more of the natural health community. You can assess the intensity of your vagus nerve, or how balanced it is with your sympathetic nervous system, with your fight or flight, by measuring heart rate variability. And that is basically when your heart beats, let's say it's 60 beats per minute, right? Just on average, let's say you have a heartbeat of 60 per minute. It doesn't mean that at every second your heart beats exactly at the same time. Some of the heartbeats will be further apart, and some of the heartbeats will be, closer together, even with your breathing cycle that is influenced. So in general, we say the more variable you are, so the more you would think that like picking like a metronome would be good, but in reality, that actually shows the more variability you have, that means you're more adaptable. That means you have more of a tendency to respond to things with more resilience. It's very interesting. So you can actually measure that. There's certain watches, I believe, some of the smart watches can do that, and there are some devices that are more accurate than generally than like an Apple Watch. And basically, they've been studying this, and it's a good predictor of cardiovascular disease, some emergency situations in cancer, and even in dementia. Elderly with a greater heart rate variability, they actually have they're less prone to having dementia. Part of that is probably because, we've talked about the inflammation. Like if you're in sympathetic overdrive, you have more inflammation, brain inflammation. Obviously, that can be good for mental health, especially as we're trying to be cognizant of our brain aging. So I was trying to say something else with that. Oh yeah, so what some people actually do is, as they practice things like breathing exercises, and they get direct feedback from the device that measures their heart rate variability. So you can see in real time if you do breathing exercises or things like progressive muscle relaxation, you can have a direct feedback. It's called biofeedback, actually. So that's quite interesting to see it in real time. Some of the things, with just some of the data. So with people with diabetes who have more variability, they're more adaptable. they tend to have lower hemoglobin A1C, lower average glucose levels. Heart rate variability that was very low, it posed a 4-time risk of overall death, actually. So death from all causes. And I really like this, the number 4 point, when you see increased heart rate variability results in increased impulse control. So if, people who struggle with like, emotional eating or just impulse control in terms of like, when they are stressed, they tend to go to certain things that they don't want to go to. So if you can bring your heart rate variability up, if you can stay in more of a relaxed state overall, that doesn't happen as much. So again, working on things like physical activity that increases heart rate variability. There are some stimulating devices that actually can stimulate the vagus nerve, breathing techniques, and there are herbal, there's herbal medicine also that addresses that. One more thing here, we talked about, blood clotting. So stress does 2 things. It actually causes some of the lining. The endothelium is the lining of your vessel. So if that gets damaged, then the platelets, the little things that clot in your blood, they can stick to the vessel wall. That's what happens, like, for example, in someone who has a heart attack and they have, all of a sudden a lot of those platelets go to that injured endothelium, that injured plaque. That's why stress and somebody having an acute heart attack are related, because you get into this state of more blood clotting, basically. And if it happens in your heart vessel, that's bad news, unfortunately. That's a heart attack, right? Or a stroke if it happens in one of the major arteries of the brain. Vitamin C has been shown actually to reduce that state of, increased blood clotting when there's acute stress that's present. I'm not going to get into this. We could spend, hours talking about the gut biome, but know that you are influenced. So there's a 2-way communication. When you're under stress, your gut biome actually shift to a more pathogenic, so more harmful state. So your chronic stress actually affects your microbiome. Also, if you eat bad and you have a bad microbiome, that can make you stressed too. So there's a 2-way connection. So working on the gut while you're working on stress is also a good thing, especially, like making sure that you diversify your fiber intake from food, mainly, not, supplements are great too. But we always start with food, right? Whenever we can. Food is medicine. Okay, so we'll talk about the botanical second. Actually, we're going to spend a few more minutes on lifestyle interventions. How many of you have tried things like hot and cold therapy? So sauna, cold plunges. You have? What do you do? Cold plunge? Okay.
Use the hot water.
Yeah. Yeah. So you do cold showers?
Yes.
Absolutely. Absolutely. I don't know how many of you knows Dr. Andrew Huberman. He has a really good podcast called the Huberman Lab, and he's a neuroscientist, PhD. He just put out a 2-3 hour podcast on the dopamine system, and he talks about how the things that we don't want to do, things that need, like you to persevere. So like cold exposure, like I don't think many people like that. But that actually increases your dopamine levels for hours and hours. And that actually, like you feel just more even, right? And you feel more motivated too, to do other things. But anytime you do something that you have to overcome, that actually helps with your dopamine levels and your motivation levels for everything else in life. So that's very interesting. Exercise is very good with stress. How many of you have experienced that if you have a good workout, or you have like a nice, where you get your heart rate up, you work out, and then for the rest of the day, you're just like, something is different, I feel more, yeah. Especially if you don't overdo it. So there's a point where you tip over and you're just like tired after the workout. But there's a point where you can still get away with some reserves. That's the place to be. And actually HRV, heart rate variability, actually does, thank you so much. Heart rate variability actually does help you determine if you've done too much with your workout. So that's very interesting. Some people track that like when your heart rate variability goes back up, that's when you're ready for your next workout, whether it's a day later or 2 days later, if you do an intense one. Progressive, how many of you know progressive muscle relaxation? Has anyone ever done that? You have? Awesome. Do you do that regularly or? Okay, nice. Excellent. Excellent. Very good. I would say personally, I do all of these. Progressive muscle relaxation is the one I do the least. I actually default more to breathing, like when with that, and when I pray, when I try and go to sleep, like I just do, and even when I walk into an appointment that I'm trying to get ready for the appointment. As I walk to the appointment or as I drive to the appointment, I slow my breathing down. I do something that's called square breathing. It's the most simple breathing technique. 5 seconds in, 5 seconds you hold, 5 seconds out, 5 seconds you hold. And you can even, if you don't do that when you're driving, but if you're like laying down, you can even like picture, close your eyes and picture like drawing a square as you are. So that really kind of helps you, not think about all of these other things like paying bills and all that. Like it kind of helps you stay focused with your mind, right? That's also important. I love this book. I recommend it to probably every client that I have. Do you guys notice? Yeah, amazing book. When I first moved to the US in 2012, our pastor was doing a workshop. He took like 2 months, I think, 2 or 3 months, going through this book chapter by chapter, and just like we were like teasing it out. I'm like, this is the most amazing thing, and it really works. So it's really about like taking responsibility and stewardship of your relationships, but not just that, your time, your health, and people who are here, you are all proactive with your health. You wouldn't be here if you weren't. So you're those kind of people who are not just like throwing up your arms and be like, well, medical system, just take care of me. But you wanna take a proactive approach because you know that that's your stewardship, that's your body, and and certain things we can't do, but the things we can do, we want to do. So really helps. He who has no rule over his own spirit is like a city broken down without walls. So that's what boundaries is about. If you don't have boundaries, it would be like a city that's just like, come and, ransack me, So the enemy just goes in and out, no, containment of things. PMR, we talked about this, completely free intervention, right? They did a study in a nursing home with a group of the residents, elderly residents. After what was that? 1 month, their immune system was functioning better. Exactly what we talked about, the natural killer cells that are responsible for viruses and anti-tumor activity. It was better in the group at 1 month of this completely free intervention, right? I mean, how awesome is that? The other one is patients who are diagnosed with I think it was melanoma. Yeah, melanoma patients. So they started doing psychiatric intervention to actually care for their souls and spirits, right? Lo and behold, after 6 months, their immune system was better than the people who didn't receive that. After 6 weeks, they did not see that difference. It needed 6 months. It's like a lot of these techniques, they take time. I mean, herbal medicine is also, it's not heroic medicine. We are in it for the long run. We want to establish foundations. We want to establish resilience. That doesn't happen from, it's not like you pop an ibuprofen and your headache goes away. This is it's a course that you have to run. So yeah, chill out, take a bath. It's good. Other things, social support. So we talked about VEGF. VEGF is basically an agent that the cancer cell, and not just cancer cell, but cells release to grow more vessels. That's how cancer cells grow. They have to have blood supply. They put out more VEGF. So what they were noticing is that loneliness in cancer patients increased their VEGF. So it was the cancer had more free reign to grow new blood vessels. Whereas people who reported that they had great social support, they felt like they were supported from their friends and family, their VEGF was lower. That's very amazing, I think. I actually put out an email on this to reach out to a cancer patient today. I think it was my last e-blast. Because oftentimes what happens is that someone gets diagnosed with cancer. Initially, everybody's like, "Oh, how can I help? Do you want a meal? Whatever." 6 months go by, and they say nobody reaches out, and they're still fighting the battle. Every day they're still going through the side effects. They're still trying to make it, and people just disappeared. So we wanna be there, on the long run. Some of the dietary factors, you probably all know this, but some of the things we address: blood glucose, food additives, the removal of them, fiber content. Really amazing study from MD Anderson, actually. Melanoma patients were receiving immunotherapy checkpoint inhibitors. They were looking at the fiber intake of the people. Every 5 grams of fiber, it's not a lot, every 5 grams increased survival by 20%. Every 5 grams increased survival by 20%. Imagine that. It's because of, checkpoint inhibitors. Immunotherapy actually works with your own immune system. So not a surprise if you have a healthy gut biome. If you know anything about, the microbiome, not a surprise. We know it communicates with your immune cells, right? So if you have a more robust gut biome, you're going to respond to that therapy better because it utilizes your own immune system. You have to have a more robust immune system for those to work. Okay. Very interesting. I just thought of this a few weeks ago as I was preparing for this presentation. Isn't that interesting that the very first and the very last chapter of the Bible addresses herbal medicine or herbs in some way? So then God said, "Behold, I have given you every plant yielding seed that is on the surface of all the earth, and every tree which has fruit yielding seed, it shall be food for you." So this is, we call these, like in herbal medicine, we call them food herbs. Blueberry, ginger, turmeric, they're food herbs. So you can use them and you can eat them as food. You don't have to have a specific condition. Like you wouldn't eat poke root, which is a toxic herb, but it's a very potent anti-cancer and lymph mover. You wouldn't eat that because it's not a food herb. It's a toxic herb, actually, but food herbs here. Last chapter, on each side of the river stood the tree of life, bearing 12 crops of fruit, yielding its fruit every month, and the leaves of the tree are for healing of the nation. Isn't that amazing? Very first and very last chapter. So not a surprise that herbs can do amazing things for us, right? When I think about stress and addressing stress with my clients, I think mainly, not only, but I think mainly of 2 groups of herbs. One of them is called adaptogens. How many of you have heard of adaptogens? Can you name an adaptogen? Ashwagandha? What is this on the picture? Anybody knows? You get a free product if you know what it is. It's rhodiola rosea. The other end is nervines. That is passiflora incarnata. That's passion flower there. It's an amazing nervine. So those are the 2 groups of herbs that I generally go to with my clients. Adaptogenic herbs. Let me see where we are at. Okay, perfect. Adaptogenic herbs are they're not new herbs in the sense that they've been used for hundreds of years, if not thousands of years, in herbal traditions like Ayurveda, TCM, things like that. Like you mentioned ashwagandha, or Panax ginseng in Chinese medicine, and being used, thousands of years of history. But the research on adaptogens and the coining of the term adaptogen is actually from the mid-1900s, when the Soviet Union was trying to enhance their population. This is in the middle of the Cold War. They're trying to come up with ways to train better astronauts, better sports people, better citizens, people working at the factories, people who are putting down railroads, to make them more resilient, more productive than the West. So that was their purpose. They tried things like amphetamine because that was used in World War II, amphetamine to enhance, to increase the soldiers' longevity. Not longevity, but like endurance. It works for a few days, right? And after that, they just crash because you burn up the reserves. So they were experimenting with other herbs. And the first herb that was studied as an adaptogen was actually Eleutherococcus senticosus, or Eleuther. Siberian ginseng we also call it that, but it's not a proper term. It's not a ginseng. There's no ginsenosides in it. So they noticed when they were giving Eleuther extract to people who were working at a factory, they had less sick days, they were more productive, they had less work accidents, they were more focused, right? Then, at the other factory, they would just give vodka. So that was the placebo, because this is alcohol extract. And, they would give vodka, and here, you take this, there was no, consenting for that study. So basically, Eleuther was the first one. And then they started studying various herbs from these traditions that are known as rejuvenative tonics, rasayanas, in the Ayurvedic tradition. And now we have about a dozen or two herbs that we know for sure, or with pretty high confidence that they are adaptogens. So how do you define an adaptogen? They increase your ability to respond to stress. That's very simple. And in a non-specific way. You can't put your finger on it. They just, again, they experience less sick days, more work performance. It's not like because they had more muscle strength. It was an overall effect on the body. They also, number two, they balance and strengthen the nerves and the immune system. Adaptogens have this amazing ability. Most of them do anyway. I think all of them probably. I would say more than adaptogens have that, but all the adaptogens have this ability to balance the immune system. So what does that mean? When you have an autoimmune condition, that means that your immune system overacts. It's overactive in a certain way. It attacks cells that are self. It's not, your immune system is supposed to recognize cells that are your own by the surface receptor patterns, but they don't have that. Your immune system just loses that ability for whatever reason. Maybe it's a food cross reactivity, maybe it's bad gut health, maybe some of it is genetics, undoubtedly. And so adaptogens actually calm that response down. So it actually tells that part of your immune system, hey, don't be so don't be so hasty. Let's back off. So it tones it down. But if you give an adaptogen to someone who gets colds all the time because their immune system is under functioning, they actually get sick less. So it has this bilateral, or I would say like bilateral, or what's the bidirectional kind of effect, both an over and an underactive kind of situation. They can tonify, they can bring back to balance. And that's an amazing thing. We have very few things, if any, in Western medicine that works. Medicine usually works one directionally. It's a stimulant, or it blocks something, or it increases something. But that very fine-tuning effect is very specific to herbal medicine, right? So, and then they're very safe and administered properly. I would say maybe one exception is licorice, where you can, if you overdose it, and it's a probable adaptogen. It's not we could put it in that category. You can cause, hypertension, but it has to be very high doses, and you have to have a susceptibility. So this is not going to cover all the adaptogens. I just picked a couple samples, kind of, I would say arbitrarily, honestly, from my inventory. So American ginseng, or Panax gingifolius, is an endangered species. It's native to the North American continent. So the ethical way of using American ginseng is if you consume organic grown, so farm grown ginseng. Wild harvesting of American ginseng at this point is not that you would probably find much in Texas anyway, but that it's an endangered species. So we want to let it grow. We don't want to harvest herbs to the point of extinction. That's not good stewardship, right? We want to be mindful. They're helping us. God gave them to help us. We want to steward them well. Couple of studies, 2 grams taken per day improves cancer treatment related fatigue. And the standardized extract, trademark name Cereboost, it actually significantly increased calmness and work performance, even just 1 hour after digestion. Now, a lot of these adaptogens actually work long-term because they turn on certain even gene expressions in your body that take some time. But if you took a shot of ashwagandha like tincture, you would actually feel calm pretty fast from it. So there are certain effects that you feel right. Or if I gave you Panax ginseng, you would feel pretty alert pretty fast. So American ginseng is a little bit less stimulating than the Asian ginseng. Asian ginseng is probably the most stimulating adaptogen we have, along with maybe a rhodiola. And that's another thing with herbal medicine, is that generally we don't use single herbs. This is more of a Western phenomenon that we want to just take, like one single herb. And sometimes it works, especially if you just feel tired a little bit. Maybe you take some American ginseng, you don't have anything, much going on. That's okay. But in general, traditionally, the use of herbs is very complex. They would put a formula together, 5, 6 herbs. In Ayurveda, I mean, sometimes they put 50 herbs in a formula because they each have their own role. And they balance each other out. So when you take an herb like Panax ginseng, that's very, very stimulating. If you put other things to it, like let's say some lemon balm, let's say some passion flower, maybe some ashwagandha, which is a calming adaptogen, you already have a formula that's not going to like, drive your energy as much, and you're not going to feel like jittery and all that. Some other benefits, Molly. Yes.
Like I start our palpitations
Mhm.
like 30.
Do you have that? Do you have that? Like, meaning like, do you have that? Is that something that, yeah.
Yeah.
Yeah, and that's the thing. So, so you actually experience that.
Yeah.
So absolutely, that's why we don't usually do single herbs because, so in Chinese medicine, for example, the way they formulate things is they put something that's called the king herb in the formula. That's the chief herb. That's like if you have a pattern in a TCM pattern, let's say, I don't know, deficient spleen chi, which is, it's one of the things. So I would give you Asian ginseng is actually a spleen chi tonic, so is astragalus. So maybe those are my my king herbs or chief herbs. Then they put deputies. They call them deputies. They basically, they go by the government, right? So then they put the deputies in there that are also supportive herbs. But they are, they basically come alongside and address some other patterns. And then they have the servants or the ministers, I think they are called. They are actually there to lessen toxicity if I'm using a toxic herb, or if I use Asian ginseng because I'm like, oh man, this is for you. That's the perfect herb, but you're already kind of like wired. You said you have a hard time. Yeah. So I would say like, okay, so my minister would be like something that's very calming, like Sanzao Ren or something like that, like something that will like really bring you to counterbalance, or some of the herbs in TCM and a lot of the herbal traditions, they observe energetics a lot more than we do in the West. They say like, okay, is there a lot of dryness in that person? Is there constipation, dry eyes, dry mouth, vaginal dryness, things like that? If I give that person a lot of dry herbs, maybe I'm doing good thing, like physiologically, but I'm going to dry them out even more. So I need to use moistening. American ginseng is a moistening herb. So I would want to, bring in things that counterbalance. If I'm using a drying herb like rhodiola, because I think that would be amazing for you, I want to make sure that I have other herbs that will counterbalance that effect so that energetically the formula also fits you, not just from a overall effect, right? Does that make sense? Okay, so ashwagandha is our next one. Very interesting. So in Hindi, the name is ashgand, which means strength of a horse or sweat of the horse. Actually, I can, it's funny. So the sweat of the horse refers to the fact that, not that you will be sweating like a horse, it's that it's more like the strength of a horse, that you will have more strength, you have more stamina, you will have more like physical strength. Ashwagandha research shows that actually it increases testosterone. You can bench press more with more weight if you take ashwagandha. You can, so like they studied all these nuances. It improves in males, it improves semen quality. It increases fertility. So it has all these like, stallion kind of features. I will say that the sweat of the horse is also pretty fitting because I broke a glass in my wife's car once, and boy, it stank like a stable. So obviously this is just a joke. That's not why it was named that, but it's because of the stamina that it gives. Also, if you look at the Latin name, Withania somnifera means sound sleep. Somnifera, it means sound sleep. So it's again, complexity of the herbs, because we're not talking about one ingredient. We're talking about a list of maybe 40 compounds that are active in the ashwagandha root that I extract either in a capsule or in a tincture, or if I decoct it, if I boil it, it gets into the water. So all of those things. So how is that he's going to enhance my workout and he's going to make me go to sleep, right? That's the amazing thing about herbal medicine that I love. Some of the things here, it basically reduces the cortisol expense. So the amount of cortisol that you have to spend to deal with stressors. So your cortisol doesn't run as high. It actually helps you to manage those things with more of a calm spirit. high dose. It was 2 grams 3 times a day. And again, these are single herb studies, so this is not how we would use them, but it's just interesting to see what the literature says. It actually, improved fatigue, physical, emotional, social functioning, insomnia, and pain in breast cancer patients. And it was non-significantly, meaning statistically non-significantly, p-value, this is, if you know statistics, p-value was greater than 0.05, increased survival at 24 months. So the ashwagandha group's survival rate was 72% versus 56% in those who did not take the ashwagandha. It may have been that it was not non-significant because the sample size was too small, actually, as oftentimes happens. Some of the other things, chemotherapy and herbs, right? That's a big topic. Oncologists will say, oh, don't take it because, we don't know what, and there's a lot of literature out there that actually shows that most interactions with herbs, you do have to be careful. I'm not saying that you can just take whatever, but a lot of herb and drug interactions are positive. You either have less side effects or you end up needing less medications for the same amount, and that means less toxicity for the same kind of results that you would have otherwise with a higher dose of the drugs. So just some effects. Ashwagandha protected cyclophosphamide, an alkylating agent, liver damage, bladder damage, and bone marrow suppression. It was counterbalancing that effect. Some other benefits. I'll highlight one thing. Ashwagandha is probably the most effective thyroid stimulant. So it's a really good herb for people with Hashimoto's thyroiditis, which is an autoimmune disease, right? It basically, your thyroid is being attacked by your own antibodies, and then you end up dropping your thyroid hormone levels. Ashwagandha will help not only just to boost the thyroid function, but also to balance the immune system so you don't have that immune response. So selenium and vitamin D are also two things that have been studied for Hashimoto's. It lowers antibody levels against the thyroid. We talked about the other things. It has some muscle relaxant activity. It can be used in PMS and during menopause. So both with menstruation and with periods, and with menopause. Fibromyalgia, it's an excellent thing with fibromyalgia because most fibromyalgia patients can't go to sleep. They have a hard time going to sleep. They don't have the energy to go to sleep, actually. So you need to get them back to a good sleep pattern and be able to rest, be able to give that deep, nourishing sleep. Polybasil is a milder, it doesn't have those steroidal saponins, some of those in compounds that an ashwagandha or a ginseng would have, like that very deep, kind of almost like hormonal qualities. But it's a mild adaptogen, but it's very nice. It can work as a tea, although it has a strong flavor. I do like it, but if you want to take higher doses, you might want to go with a capsule or a tincture. It's been studied for a lot of things. It's pretty specific for brain health. So people with brain fog, mental things like, traumatic brain injury, that kind of like cognitive, even I think it would even work well with like a COVID, like if people have brain fog after COVID, it helps that it really has that like cerebral, that brain kind of affinity. Some other things that we can use it for: stagnant depression, which a person is depressed because of a certain event, like they just can't get past that event. Maybe 2, 3, 4, 5 years have passed and they're just stuck in that state. They orbit around that event, right? We would use it with things like lavender and rose petal and things like mimosa bark in that situation. Anytime you taste an herb and it has like an aromatic taste, think about like cinnamon, cloves, polybasil, lemon balm, like you know that there are essential oils in there. They will be all good for GI health. So like if you have bloatedness or like kind of like GI discomfort, dyspepsia, things like that, usually those herbs will have that positive effect, like that calming effect, because they do have essential oils in them that are anti-inflammatory, generally relaxant. Peppermint, exactly, spearmint, anything that you taste it and it's kind of tasty, like it has a good taste. Like all these are spice herbs, basically spice or tea herbs that we usually think about. helps relieve viral diarrhea, and increases breast milk production. I think we have about, I was planning on doing this until 12, but maybe we can go 10 more minutes. I don't think we can cover all the slides, but is that okay with you guys? 10 more minutes? Good. Okay. Medicinal mushrooms, huge, right? We have cordyceps, which is an adaptogen. So cordyceps actually is used by a lot of athletes because it helps prevent overtraining, actually. It makes you stronger. It has we'll have a slide on cordyceps, so I'm not gonna talk about all that. But probably the most robust research we have on cancer, actually, with a positive effect, especially in the immune health area, are chaga, reishi, and turkey tail. Those are three most researched mushrooms in that sense. How many of you have heard of cordyceps? Okay. Do you know that why it's called the caterpillar mushroom? So the way cordyceps, the original cordyceps sinensis, because there are a lot of actually species of cordyceps, but originally cordyceps, the cordyceps sinensis strain or species, it actually puts, the mushroom puts its spores in the ghost moth larva. So the worm basically that will turn into ghost moth. So it basically, and then the spores start to grow in the worm, and they overtake it. They cannibalize the worm from the inside out, and literally the fungi, like the fruiting bodies, will come out of the head. It's like a zombie movie kind of. It will come out of the head. Like that's a not a really great picture there, but I didn't find any better free images. So and I don't have my own photo of a cordyceps. So it literally bursts out, the fruiting body bursts out from the fungus. So it's called a caterpillar mushroom. If you would buy that original one, which is kind of interesting to think about it, you have to really make sure that you have to cook the heck out of it to get rid of the bacteria. Most of our cordyceps that you would find on the shelf or you order online, they're grown on oats or something like that, or rice, so a different medium, not worms. But that's the original one. And if you were to buy the original one, it would cost you like $5,000 a kilo. So very expensive. Some of the other uses, other than it being an adaptogen and helping with stress, helping with that physical endurance, it's one of our primary kidney protective herbs. So cordyceps, astragalus, and stinging nettle seed are incredible. We've had multiple case reports of people not having to go on to dialysis. Their progressive kidney disease stopped because they were taking those formulas. Again, cordyceps, astragalus, and stinging nettle seed. Very good formula there. It's moistening and strengthening to the lungs, so we might use it even in dry lung conditions, and etc. Chaga, notice it basically has a lot of traditional use in Russia and Scandinavia in various cancer treatments, including bone marrow, lymphatic system, lymphomas, breast cancer, prostate cancer, lung, things like that. What it does is actually, so the Th1, Th2 balance, we talked about it before, I didn't get into this, but it basically, it helps with that. We talked about a cellular response, right? The cellular response of your immune system is what helps with viruses and with cancer cells. So chaga will work on that. It will bring that back up instead of the Th2, which is more the humoral, the antibody kind of immune response, which is often overreacting, and that's what causes autoimmune problems. So it down-regulates that. That's how it helps both ways. We talked about that, right? Like for somebody who's under-functioning, it will improve. Somebody who's over-functioning, it will down-regulate. That's how it brings that balance, is through that Th1, Th2 balancing. It's high in oxalates, so don't take more than 5 grams a day. You might end up with kidney stones. Some of the other anti-inflammatory effects of chaga. Shatavari is a mild adaptogen. It's really good for women going through menopause. It's very moistening. So some of the those effects, when estrogen drops, there's a lot of dryness that ensues, that comes along with that. In Chinese medicine, it's actually called yin deficiency. So that moist quality of the body is going to dry up. So we want to bring it. That's when we definitely don't want to do herbs that are very drying, because the person might have more energy, but she'll be like, oh my goodness, like tell you about dryness. But things like shatavari, which is moistening, would be a very good idea. It's mildly adaptogenic, helps with that coping with the stress to some extent, not as robustly as like a ginseng, but it does have some effect. And hepatoprotective, and there's some other herb drug interactions there that are also positive, including helping gastric ulcers and preventing aspirin-induced gastric irritation. Again, that's probably because of the moistening ability. It helps moisten that GI tissue as well, the GI mucosa. Okay, so the last group of herbs here are the nervines, and basically they help us strengthen and tonify the nervous system. They often work on multiple receptor sites, if you're familiar with things like GABA, and then 5-HT, that's serotonin, and then dopamine receptors. One of our primary herbs is St. John's wort, which is the poster child for herb drug interactions, but literature shows that it's not as obvious. So just because it modulates the amount of medicine that's in your body, it doesn't mean that it necessarily actually will cause a negative side effect. You do have to be careful though. So this is an area where, if you're not familiar with that, work with someone who specializes, because you can mess things up if you're not careful. But very robust research, mainly that St. John's wort basically helps you, the forgetfulness and things that you get when you are under chronic stress. So that's what it reverses. It reverses that neuroplasticity, the brain cells' ability to connect with each other, to make neurotransmitters, to even develop new nerves. It has relevance in Alzheimer's disease and learning and memory. Here's just a summary on some of its effects. Of course, we know it these days as an antidiuretic. I didn't mention that. Historically, though, it actually, I would say somebody was showing the homeopathic, yours. So I think there's some hypericum in there too. Generally, they put that in homeopathic and actual tinctures, nerve formulas, because historically it was used to address nerve pain, sciatica, even Bell's palsy and facial nerve pain, like nerve pain of the face, etc. Some of the other ones, there is phantom limb pain, neuropathy. Passion flower, that's the beautiful plant that you saw on the first page. Really good to kind of like shut down, like if you have circular thinking where you lay down and you're like, you just keep thinking and thinking and thinking and thinking. It doesn't let you go to sleep. So passion flower really helps with that. We actually have a nice lozenge. I work with a brand that has a nice passion flower lozenge that I like to just pop sometimes during the day if I find myself overwhelmed. Fear, lack of concentration, nausea, trembling, palpitation with people with anxiety. It was reducing all that, so very helpful there. It can be given for hyperactivity type ADHD. Then part of a protocol, if you're trying to wean somebody from opioids, then it can be of relevance there as well. Mimosa bark in Chinese medicine is called the collective happiness pill, Hak1P. It actually is a quite strong, mood lifter. So much so where if somebody has bipolar disorder, you would want to probably avoid this or be very careful. And it actually, so instead of being like some people, what they complain of when they start taking antidepressants for depression is that they're not depressed, but they also are just kind of stuck. Like they're flat is the word. Like there's just the flatness. So mimosa bark is actually a moving herb. Like it moves blood, it moves chi, it moves that energy. So it also moves emotions. It can be given to people with PTSD if they want those emotions to surface. So it actually kind of like moves you out of that place of stagnation. So it can be helpful there. And in addition to that, it has VEGF. We talked about, the vessel growth effects of when cancer grows. So albizia also actually, or the extract of it actually suppresses that. So another way to address, cancer growth. talked about these. Kava, you're probably familiar with this. I would probably use kava if there's muscle tension, muscle spasms associated with anxiety, because it's a nice muscle relaxant. It also helps with bladder, actually. So bladder spasms, overactive bladder. It also has some basically pain relieving activity in UTIs. It actually helps to coat the bladder in that way. Has some pretty good anti-cancer effects in vitro and in vivo. Modulates the immune system. And then the last slide is some of the nutrients. So y'all are probably familiar with these, but magnesium is amazing. I mean, probably the number one thing we are depleted in or from in the West is magnesium. It's very, very commonly used, ubiquitously used in the body. A lot of the functions, enzyme functions, they use magnesium as a cofactor. People say 300 plus enzymes, they use magnesium. So high demand in the body, low supply in the food chain. We have depleted kind of our magnesium supplies from the soil. So even if you do organic, that's great because, no pesticides, but it might still be nutrient deficient in certain ways. Nuts tend to be higher, nuts and seeds tend to be higher in magnesium. But supplementing that, I think, is a really good idea, especially if you have things like restless legs, sleeplessness, or you undergo, chronic stress. Glycine, so there's magnesium glycinate. You can combine the two. That's a really good way. And actually, glycine is a calming amino acid to the brain. L-theanine, you can take that as a supplement. It is also in green tea. So green tea is not only great for, it has great polyphenols in it. And it does give you energy, but it doesn't jitter you generally as much as coffee, because in addition to, the caffeine or the theanine, it also has the L-theanine. So it has that calming amino acid in it. Really good research also on some of the extract like EGCG and in certain cancers, especially with certain chemotherapies like Herceptin and things like that. L-tryptophan, the last one, basically your body takes L-tryptophan and turns it into serotonin. So I think I usually like tryptophan better than 5-HTP, because 5-HTP can only turn, basically your body can only turn it into melatonin. But if you give your body tryptophan, your body can turn it into melatonin or serotonin. So you don't tell your body as much like what to use it for. And I think we believe in that innate wisdom of the body to be able to know better what to do with that. So that was my last slide. Again, this is my website. If you wanna check us out, I do health coaching online. And there was a little piece of paper that was going around. If you wanna put your name and your email address down, I will include you in my e-blast. And we do, again, we don't do it. We're not gonna bug you daily, but just like a few times a month, maybe 2 or 3 times, you'll get a little email and something informational, or if there's a new talk that's coming up or something like that, you'll be notified. And yeah, any last questions?